Would PRP vampire technique help my skin to heal or get back to the stage it was 3 years ago? My face got damaged 3 years ago with microneedling and Tretinoin 0.025% cream. Now that a long time has passed and cell turnover did not heal my skin, I'm trying to find some natural way of getting my face fixed. Plastic surgery or PRP are two options. Can PRP do any further damage to my face? I'd rather pay for something that can't do any damage, any good, but there is a possibility that it helps, than pay for something I must regret for the rest of my life. Could someone please help me? Thank you.
Thank you for your question. You're asking about trying to restore skin that you described as being damaged from microneedling and the use of tretinoin, and that you would prefer to do something that won't cause damage, and you want to learn more about PRP and the Vampire Facelift treatment. Well, I'll tell you that you are certainly in good company. I'm a cosmetic surgeon practicing in Manhattan and Long Island for over 20 years, and I've seen a lot of different modalities come and go with the expectation that certain level of trauma to the skin will result in improvement. And that concept is true, but there have been many patients who have come to us who have had, for example, frequent laser treatments or have had repeated treatment with thermal devices with the intention of tightening skin. There's a very straightforward threshold where beyond which you can't stimulate the skin from just heating it or ablating it enough to get enough collagen. And so in our practice, we've actually used platelet-rich plasma to help a lot of people who have had issues related to hyperpigmentation, related to loss of volume in the skin. For example, we've used it in the tear trough area for hollowing, thinning of the skin, for a variety of reasons, including lasers. So, although the photos you submitted have been, of course, drawn over to protect your identity, but I would tell you that uniformly there's a couple of things you can be assured of. Platelet-rich plasma has to date, and I'm not aware of anything in the literature, has not harmed anyone. The reason for this is probably intuitive, but it's derived from your own blood. And it's a concentration of the healing factors, the platelets, the growth factors, the vascular stimulating factors that are necessary when you get a simple cut. So when you think about it, injecting this material into the skin and under the skin should not cause harm. Our patients report that their skin actually has a nice glow, and I've used this for a lot of revision procedures. We have patients who come from all over the world who have problems with their lower eyelids being pulled down and who have had multiple operations. We've used this material to help rehabilitate the scar tissue under the eyes, and in addition support the surgical procedures that we do in order to restore their appearance. I've used it to help scars improve in appearance, and these are scars that are all over the body, not just in the face. So just to give you an understanding of what the vampire procedure is, well, there's the Vampire Facelift, and this is simply a concept of using a single syringe of a hyaluronic acid filler in combination with platelet-rich plasma, and you may find that there may be some value in combining platelet-rich plasma with volume correction. You can only get so much improvement of volume, which really platelet-rich plasma can't do that much. It improves skin quality, skin thickness, but it does not restore volume in the way a filler does. And so that's something you have to understand. There is the Vampire Facial, which was made very famous by Kim Kardashian. because it involved combining platelet-rich plasma with microneedling to the skin, and she made it famous because she had a lot of little blood spots on her skin from the level of depth of the microneedling. Now that can always be adjusted, but I think you're done with any kind of microneedling device. I think for you, injection under the skin done timed, and in our practice we typically do platelet-rich plasma injection over the course of every 3 to 4 months, looking at how the skin responds, and our patients seem to respond very well to this. It has a very unique niche in the aesthetic world because no filler can stimulate collagen and stimulate blood supply and create the effect that platelet-rich plasma does. So a lot of times we do this in combination, whether it's in the formal Vampire Facelift procedure or in combination with other fillers. Again, we customize for every patient. But understanding that platelet-rich plasma will probably help you rehabilitate your skin and sticking with it. You know, it's kind of, I always describe it as kind of like comparison to exercise. You don't go to the gym once and then do one set of exercise and expect that it'll last you forever. You go regularly. So platelet-rich plasma can have both a reparative benefit as well as a maintenance benefit to keep your skin looking good, which obviously is very important to you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.